Good afternoon. Hi, this is Joe Scott from Jersey City Medical Center. Welcome to the Medical Center Show. Today we have one of our premier physicians, Dr. Ken Garay, who is an ear, nose, and throat physician. We'll be right back with Dr. Garay.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Hi, welcome back. I'm here with Dr. Ken Garay. Dr. Garay is our premier chief of ENT surgery at Jersey City Medical Center. Dr. Garay, tell us a little bit about yourself.
Thank you, Joe. Good morning. Thank you for having me here. I'm a board-certified ear, nose, and throat, head and neck surgeon. I trained at Columbia Presbyterian in New York City.
So you trained at Columbia in New York City. So once again, we have the greatest New York doctors coming to Jersey City Medical Center.
Absolutely, and we're proud to be here.
Oh, great, good. And where'd you do your undergrad?
At Columbia College, Columbia University in New York City.
Okay, and then...
I went to medical school in Philadelphia at Temple University.
Okay.
And I had the calling back to New York, and so I came back to New York to Columbia. And after my training, I stayed as an attending, as a professor at Columbia for a number of years, and then branched out into New Jersey.
Great. Well, we're glad to have you at Jersey City Medical Center. Tell us a little bit about some of the problems that you see with patients with ear, nose, and throat problems.
Well, ear, nose, and throat is a wide specialty, and we see patients from complaints from ear problems, earaches, to throat aches, to sore throats, to sinus and nasal allergy problems, and to more serious issues as far as cancer of the head and neck, cancer of the voice box, cancer of the throat, cancer of the salivary glands.
So you really see a full spectrum of patients, everything from allergies to cancer treatment.
Absolutely. The specialty what we treat are patients with any disease of the head and neck region, from the neck all the way up, excluding arthritic problems, spinal problems, but the soft tissue problems that deal with lumps and bumps and as you said, sinus problems.
Wow. This is allergy season. I know.
Yes,
I feel
it
it
is.
myself sometimes. You know, I walk down the street and all of a sudden, you know, you can kind of almost feel the pollen in the air. So do you treat patients who have allergy problems?
Well, interesting that you say that. This year, probably because of the wet weather we've had over the past several months, will become one of the worst allergy season springs that we've had in years.
Oh, boy.
And as of now, even if you look at some of the pollen indicators, the grass and trees are starting to pick up right now. So you're absolutely right. And in the next week or two, when we start to see the forsythias and the grass starting to come out, the symptoms will really blossom.
And what typically are the symptoms of somebody who's got allergies? And how does it differentiate like from somebody who's got a cold?
That's a good question, because allergy, cold often present with similar symptoms of a stuffy nose, congestion, runny eyes, and usually the allergies are either seasonal, such as in the spring to trees, grass, flowers, or in the fall with the ragweed, with hay fever. Sometimes you've got allergies to indoor mold, And certainly with what happened in this past fall and winter with Hurricane Sandy, there's a lot of mold, so we have to be careful about that and cautious. To where we have more serious colds, the flu, which we've had a significant flu season this year, to more serious sinus problems. And when we talk about sinus problems, all these areas of allergy, colds, affect the sinuses.
Okay.
And just so you know, what the sinus, you know, for everyone out in the audience, sinuses are 4 on each side of the face. They're air-filled cavities. You've got in the forehead.
This is
a model.
Okay.
But just looking at your own face, we have 4 sinuses. You've got a forehead sinus, a cheek sinus, and 2 sinuses within the nose.
So when I say like I have a sinus headache, why is that?
Well,
what's that from?
It's the old Dristan commercial, if you remember,
Yeah.
where the hammer's hitting against the head. That dates us a little bit. But basically what happens is that we all produce mucus, approximately 1 liter a day, which is a significant amount of mucus. And the purpose of the mucus is to flow through the nose, the sides of the throat, to keep everything lubricated.
Right.
When it doesn't flow through the various drainage sites, the mucus can back up. So for argument's sake, the mucus flows at 55 miles an hour. If it backs up and is only flowing at 45 miles an hour, it sits longer, it becomes a sewer and a source for infection.
Wow.
And everything drains through the nose. You know, I like to say that the nose is the center of the universe.
Right. So how do I know I have like a sinus infection then?
Well, again, a cold is something which is self-limiting,
right,
which will go away after a couple of days,
right,
but an infection lingers, and you'll often find that there's a foul-smelling discharge, the mucus you have turns yellowish to greenish, and it just doesn't go away on its own.
Oh, okay. So that's really when you have an infection versus, you know, sometimes I just get a runny nose and it's clear liquid coming out of my...
yeah, and that could be an
really
allergy or a cold.
Okay.
Usually allergies are clear liquid, more with that itchy, runny eyes.
Now, is there some way, some survey or something that you have that kind of tells people when they have allergy problems versus other sinus problems?
Well, there's an acronym we call it the SNOT test, which is
it's appropriate.
It's an appropriate test, but it's a sinonasal outcome test where we actually ask a series of 20 questions. And patient, when they come in, and it's in a form that you can see right here, where patients answer questions as far as their symptoms, headaches, pressure, stuffiness, congestion, and they rate it from on a scale of 1 to 5, and we add up the numbers. And the higher the numbers go, that tells us how significant your symptoms are. And that correlates very well with with what our findings would be when we examine you.
So the treatment for patients with any kind of sinus problem, whether it's an allergy or anything more serious, like sometimes people complain that they just can't breathe and they have problems with their sinuses, and so there's a whole host of treatment options, right? Correct. So tell us a little bit about, starting with medication, for example, all the way up, because you do some surgery, right?
Yes, I do.
Okay.
Yes, I do.
So tell us about the meds first.
Well, I think the most important thing is you have to have the proper diagnosis.
Right.
And the worst thing that a patient can do, and I'm a patient as well as you are, and we're all patients, is to
You yell at me all the time when I do that, when I take the wrong medicine.
Well, and physicians are sometimes the worst patients, but
for sure.
But we cannot self-diagnose and self-treat.
Right.
And so if we have the symptoms, they last for more than a couple of days, really it's important to go see a healthcare professional, your primary care doctor, your pediatrician if you're in that age bracket, your internist, and let them examine you. Let them listen to your chest, let them examine your nose, let them examine your mouth. And if they feel that this is something which is beyond just an ordinary cold and allergy, then really you should ask to be referred to a specialist, either an ear, nose, and throat specialist if it's a sinus problem, or perhaps if they really feel it's an allergy, an ear, nose, and throat doctor who deals with allergies, or an allergist to diagnose and examine. So
the first stop really is your primary care doctor.
Is your primary care doctor, and really make sure that so we know what you're dealing with and what we're treating. Once that's done, the treatment depends on what we find.
Okay.
If you have an allergy.
Yeah. Let me hold you right there because we're going to take a break.
Okay.
We'll be back in a couple of minutes with Dr. Garay. We're going to talk about some allergy medication and some other treatments for patients with sinus problems.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back. This is the Medical Center Show. I'm here with Dr. Ken Garay, our ENT specialist. We were talking a little bit about treatment for patients with sinus problems. Tell us a little bit about the medications that are used to treat the patients with sinus problems.
Sure. Again, it depends on what the diagnosis is. If you got plain allergies, there are antihistamines, decongestants that can be used. But I caution that a patient should not self-medicate because a lot of these medications can have severe side effects. For instance, antihistamines can make you tired.
Right.
And if you take too many, it can impair your driving.
Right.
And in some states, if you're stopped by a police officer under the influence of antihistamine, that's as if you're caught under the influence of alcohol.
Wow, okay.
Likewise, some of the decongestants can make your heart race, so it can interfere with important life functions. So to self-medicate is not a good idea. So there are antihistamines, there are decongestants. Once we get past that, if you have an infection and it's deemed by your physician to be a bacterial infection, there are antibiotics, and there's of course several antibiotics that we likely give based on what we think the bacteria is, and we treat a patient for their acute sinusitis.
Right.
There are also steroid inhaler sprays, which we use, which are very good sprays to help locally clear up the nose. And I mentioned the word steroid sprays. People shouldn't be alarmed. This is not like steroids.
It's not like testosterone.
It's not testosterone.
It's not that kind of steroid.
You're not going to become a bodybuilder and wind up in the Olympics next year.
See, I was hoping you'd, give me
well, maybe improve your golf game.
Yeah, right.
But they're safe as long as they're used under the proper guidance and instruction of your physician. So we treat a patient with antibiotics. Let's say they get better. Fine, you go back. But if the infection and the symptoms persist of the stuffiness, the congestion, the loss of sense of smell, then it's time to go back to the physician, and we may need to do some imaging studies, particularly a CAT scan.
Okay. So a CAT scan of actually your sinuses?
Of your
Will that
sinuses.
show kind of what's going on there?
Well, what that'll do is give you an objective evaluation of the sinus cavities. As I mentioned before, we have the 4 sinuses, and they all drain really through the nose.
Right.
So it'll tell you, are they air-filled or are they filled with mucus? Is the lining thickened? Is there a blockage where the sinus is drained that needs to be alleviated?
And you can tell that just from a CAT scan?
Well, from a CAT scan, plus when you go to the ear, nose, and throat specialist, what we do is, it's a great technology that's been developed, is looking into the nose and sinuses with a telescope and a camera.
Wow.
So we can, if my pen were a camera, we can go in through the nostril and look directly into the sinus cavities and see if there are polyps, if there's a blockage, if there's thickened lining that's obstructing the flow of mucus.
Wow. Now, CAT scan's really not a big deal, right? I mean, it's not.
No.
It's a pretty quick test.
In 2013, CAT scans are quick. A CAT scan of the sinus is less than 5 minutes.
Okay.
The radiation that people always worry about is very minimal.
Right.
So it's really a very safe, reliable examination. You do not need any contrast, any dyes. It's a strict picture that we are able to then see.
All right. So now you've got this blockage, or you said that there could be a polyp or something else going on. You can't just take medication for that, right? That's not going to fix a blockage like that. So
no,
what's the treatment?
Well, it's like, very much akin to trying to get into Manhattan to the Holland Tunnel, okay, at rush hour. and particularly if there's a breakdown of a car in the tunnel.
Sure.
You got to remove the blockage.
Okay.
So
that requires something a little more than just allergy medication.
That does. But, fortunately, again, in today's era, we've made such tremendous advances in the technology of surgery that from years ago, where it was really a big deal, to today, and let me say, any surgery that you're having is a big deal. Your heart surgery that you're having is minor to me because it's on you. My toenail being clipped is major because it's happening to me. So we take all surgery seriously, and every surgery is major. But what we are now able to do with advanced technology is bring a patient, sometimes in the office, but most likely in an operating room setting, go in with a telescope, and today with new technology called balloon sinuplasty, go in, insert the balloons into the opening of the sinuses, which you can, if you look over here on this. Okay, you can see here, what we'll do is put the camera in here, and we'll go up to the forehead sinus, which is here, and inflate the balloon in the opening, and that opens up the natural opening. And
now, am I out when you do this? Am I under anesthesia?
Depends whether we like you or not. But yes, well,
better not make him angry if I need sinus surgery.
No, it's definitely, we do it under general anesthesia for the most part. But there are now technologies that we're starting to do some of the maxillary or the cheek sinuses in the office just under local anesthesia, and it works very, very nicely.
Okay, good.
Absolutely.
So it's not that painful to do this.
No, it's about but the nice thing about the CAT scan is we're able to identify which sinuses.
Okay.
So you have, let's say we have 8 sinuses, 4 on each side. You only may have 2 sinuses involved, so all we need to do is open up 2 sinuses.
Right.
And
so this is kind of really a progressive process. So first you look up with your scope, right? You talked about doing that. Then you do a CAT scan to confirm kind of what's going on. And then, if necessary, you'll go in and do this kind of procedure.
And then we sit down and talk with the patient, and explain to the patient what our findings are, what the treatment options are, and talking with what their symptoms are and how it affects their lifestyle. Come up with a treatment plan, which often will be going in with a balloon and opening up the sinuses.
Wow!
And the beauty of it is that it really is minimally invasive. It really doesn't take more than a half an hour.
Wow.
If we do it at 7:30 in the morning, patients out of the hospital or the surgery center by 10 o'clock.
I know that you recently had some patients who said they couldn't breathe. I mean, young guys, right?
People. Young athletes.
Young athletes saying they were having trouble really exercising because they were having such a hard time breathing, and then they couldn't smell anything, couldn't smell food, and had been like that for many, many years.
Correct.
And then this guy that I know you treated, it was like he said it was like a miracle.
This fella, his uncle is a chef, and we were actually talking, and he said, my uncle's a chef, but he tells me how great his food is, but I can't tell.
He couldn't smell or taste it because of the polyps. Because they were so bad. Wow.
Because they were so bad. And so I said, come on in, let's take a look at you. Found polyps. We did the CAT scan. We removed the polyps and opened up with the balloon. And this was on a Friday. He came in Tuesday afternoon. He said, I had a great meal on Sunday. My uncle made me some ossobuco, and it was wonderful.
And he could smell and taste it.
And he could smell and taste it.
It's the first time, he said, in many years?
Ever.
Really?
Ever.
So that's really kind of incredible those kind of results with really a minimally invasive procedure.
It's gratifying. It really is. Again, the where we were 30 years ago to where we are today. I remember a patient for sinus surgery would come in on a Sunday. They'd have the procedure on a Monday. We'd put this horrible packing in their nose so they wouldn't bleed for 3 days.
Wow.
Thursday we'd take it out. Friday they'd go home. Now, with the technology today, we're able to bring a patient in at 6 o'clock in the morning, operate at 7:30. They're out by 10. They're able to breathe through their nose. Usually, when we do a procedure on a Friday, they'll go back to work on Monday.
Wow, that's pretty amazing. And you do it all in our outpatient center, right at the medical center, right?
We've got a beautiful facility on the 5th floor of our surgery center, which is very, very beautiful, accommodating, allows patients to come in, move freely around, and be out by lunchtime.
Really? So that's you try to do them first thing in the morning so that they're home by lunch?
Absolutely.
Can recover during the day?
And
go out on Saturday night and have a great Italian meal with lots of garlic and smell it for once in their life.
Absolutely. Absolutely.
We're here with Dr. Garay. We're going to take a break, and when we come back, we'll talk a little bit about some more serious conditions.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Welcome back. We're here with Dr. Ken Garay, ENT surgeon at Jersey City Medical Center. Dr. Garay, we've talked a little bit about allergies, some sinus problems, some miracles you've been able to perform with people being able to kind of breathe again and really get their life back. There are more serious conditions, though, that you deal with. You're also a head and neck surgeon.
Correct.
So tell me a little bit about maybe some of those other serious things and when people should be concerned or how they can kind of prevent those things from happening.
Sure. You're correct, Joe. The specialty is ear, nose, and throat, head and neck surgery. So we deal with a lot of serious head and neck problems,
right.
Tumors and cancers of the throat and the head and neck region. So I think and those include the salivary glands by the side of the face, the thyroid gland. So I think everyone has to be cognizant of their own health and their own daily lifestyle. And so for argument's sake, a man shaves every day. When he shaves, he's got to be cognizant, I feel a little lump where I'm shaving here. If they feel a little swelling, they need to speak with their doctor and have that checked out.
Right.
You and I are wearing ties. Now, if we tie our tie and all of a sudden, other than the fact that we ate 2 pounds of pasta the night before, if we find that...
Which we are known to have done. So.
If we're trying to tie our tie and all of a sudden our collar is a little tight, and we feel we have a little lump in the thyroid, this has got to be
So you can
examined.
actually feel that?
Sure, that's right above the collarbone.
Right.
You feel your Adam's apple.
Right.
Just below the Adam's apple is where the thyroid gland lies.
Wow.
So if you feel it's a little tight, that's what happens. Women themselves, when they apply makeup, they may feel a lump that they never had or anything like that. If you notice a change in your voice,
right.
If you're hoarse and it's longer than a week or so to 10 days, particularly if you have a history of cigarette smoking. We all know the dangers and hazards of cigarette smoking for the lungs, but they also cause cancers of the throat.
Right.
So hoarseness, if you've got difficulty swallowing, all these are areas that need to be concerned.
Well, the other thing I think sometimes happens is when people have a regular annual dental checkup, the dentist takes a look in your mouth, and if he sees something, then I guess that would be another way to...
Absolutely, and make sure when you go to your dentist that he or she does do a complete examination.
A good oral exam.
A good oral exam, under the tongue, on the sides of the tongue, on the roof of the mouth.
Right.
All of that. Your primary care doctor, make sure not only listening to your heart and lungs, but to palpate and to feel your neck to see if there are any glands over there.
Now, you can do these major surgeries at Jersey City Medical Center in the event that somebody would need them.
One of the wonderful things at Jersey City Medical Center is that not only am I ear, nose, and neck surgeon, I'm also the chief medical officer at the hospital. Right. And what we've done is we've assembled a team of physicians second to none that are trained at the best institutions in the United States, from the Cleveland Clinic to Columbia Presbyterian to NYU to University of Medicine and Dentistry in Newark. Really the leaders of their field in cancer treatment. And before this show, I just came from our tumor board, where we actually discuss for an hour and a half different tumors and different cancers in a multidisciplinary approach.
Okay, so people don't understand this tumor board thing. So how many doctors were at this meeting today?
70 doctors.
There were 70 doctors.
70 doctors.
Reviewing a case that you were primarily responsible for.
Correct.
And the importance, when somebody has cancer, of that many doctors taking a look, what do you guys, what happens?
What's important, the beauty of the tumor boards are that we have physicians of different specialties, the medical oncologists, the radiation oncologists who give the x-ray treatments,
right.
the surgeons, the pathologists who actually study the specimen under the microscope,
right.
the radiologists who look at the CAT scans and the MRIs. So we all sit together and collectively, based on our experiences in treating patients with similar cancers, decide what is the best treatment for that patient, whether it be just surgery or chemotherapy or radiation therapy, or a combination of the three.
So they all kind of weigh in on kind of this serious treatment.
Absolutely.
Right? I mean, because it's a big deal when you have any kind of cancer.
Any kind of cancer is a big deal.
Right. And so are there differences of opinion about how a person should be treated, or does everybody kind of come to consensus that the best treatment methodology is discussed at this tumor board?
Well, the nice thing with the tumor board is it's led by our Chief of Surgical Oncology and Chief of Breast Surgery, Dr. Julie DeGioia.
Right.
And
she's the facilitator.
She's the facilitator. And everyone comes together in a collegial manner to discuss their experience.
Right.
And you've got, as I mentioned, you probably have over 100 years of experience in treating cancers in one room.
Wow.
And so, and treating thousands of people with cancer. So we all sit there and discuss what our experience has been in treating.
So chances are somebody probably saw this type of tumor before and have experience with successfully treating it.
Right, and it's not only anecdotal, because we do follow what we call evidence-based medicine,
right.
where we study what the best treatments have been throughout the world that have been done at the medical center, at MD Anderson in Houston, at Memorial Sloan Kettering, at all the major centers, which we have now become one, and so we now are able to, based on our own personal experience as physicians, but also our colleagues, bring it all together to give the best treatment for our patients.
Wow. When you think about it, patient comes to see you, they come to get their treatment from you, they think maybe it's just you that's treating them, but now you've had the opportunity to have a whole cadre of physicians weigh in on what's the best treatment.
Absolutely.
I mean, think about if that patient had to go to all 70 people to get an opinion. It's just an amazing kind of thing to have this tumor board, huh?
Absolutely. This has been one of the incredible things that I've seen at the medical center over the past several years, the coming together of these specialists for the patient good.
Yeah. Now, 70 doctors come? I mean, that's...
It's every medical oncologist, the radiation oncologist, plus, as you know, Joe, we're a teaching institution,
right.
So we have internists who are coming, who see patients with various cancers, and the residents who we teach and train.
Right.
And so we're training the new doctors, the doctors of tomorrow, so this way, when they see a patient themselves...
They see those signs and symptoms.
They will be aware, they'll know how to treat it, and we're not asking them to treat it, but to recognize it so that
right.
it can get referred on to the specialist for the proper treatment.
Now, when you have to take them to surgery, we also have a great group of anesthesia professionals.
Wonderful. We've got all board-certified, fellowship-trained anesthesiologists who are really trained, particularly in my area. One of the things we like to do is what we call hypotensive anesthesia, so that we lower the blood pressure to a safe level, but by doing that, we minimize blood loss.
Oh, wow.
And so we have less of a need for blood transfusions,
wow,
which
really
everyone really doesn't want to have in this day and era. So they're very well skilled in doing hypotensive anesthesia, so
wow.
we can do the surgery safely and effectively.
With minimal blood loss.
With minimal blood loss.
Oh, that's great. So your office is in the medical office building?
My office is in the medical
right on the campus of Jersey City Medical Center?
Correct.
What office number are you?
I'm office suite 220.
Okay. And we'll have information. If anybody wants to make an appointment to see you, they call
my
your office. Okay, great.
And I think we have the number. It's 201-224-4155.
Okay, great. And you're right in the medical office building, conveniently located right here in Jersey City at the Jersey City Medical Center.
Absolutely.
Dr. Garay, it's been a pleasure.
Thank you.
Thank you
My
very
pleasure.
much. Yep. This has been the Medical Center Show with Dr. Ken Garay. We'll see you next time.